Hello everyone, welcome back to Superior Physical Therapy. We're here for part 2 of our headache talk. I'm Ben Fuston, this is Keith Banley, Andrew Gorecki, Nick Hawkins, and our student Lisa from Central Michigan University that's here to help us today. Keith is going to kick us off with talking a little bit about the thoracic spine.
Alright, and so if you remember in our first talk about headaches, one of the things that I talked about that can help with headaches is working on the thoracic spine. And the reason why it's important to work on the thoracic spine is that if you have no motion through that thoracic spine, a lot of that motion is going to come up to the neck, and the neck's going to move too much. So when the neck moves too much, then you got a lot of the muscles that are attached up there, they're going to get a little irritated, and hence it's going to pull on the neck and the skull and everything and cause headaches.
Excellent.
So if you turn around, just so you know, the thoracic spine, you got the lumbar area, which connects to the top of that, and then the bottom of the neck. So right here, through this area right here, is what we would call the thoracic spine. So Lisa, if you would come over here.
Ooh, model. She can be our model. Perfect.
Lisa is one of our students here, and she is volunteered to be one of our models here. So a really good exercise to work on the thoracic spine. There's two different types of things that you want to work on the thoracic spine. Is the side bending and the rotation. It's a coupling motion, and that's how your thoracic spine moves. So first thing we're going to do is I'm going to have her reach your arm straight out here. And I like to break it down. I like to do one motion of each and then combine the two. So what she's going to do is she's going to rotate. She's going to take her arm and she's going to follow it just like that. And she's going to rotate. Now let's try this. Take this leg and step forward. So then we can lock out that lumbar just a little bit better. And then she's going to rotate like that.
I think it's really important too to realize if I have a lot of neck pain, a lot of headaches, I might want to follow my hand that's moving. So versus looking straight ahead.
Yeah.
Right?
That's a very good point. That's a very good point. A lot of times if you keep that head straight forward and you're turning, sometimes you can get a little irritation in that neck. So it's always good to go with the motion, that the head goes with the thoracic spine. So she's going to do that roughly about 10-15 times. This arm's going to go straight up. And you relax this arm, and she's going to side bend. She's going to kick her hip out, just like that. She's side bending right through that thoracic spine to the left. And then she's going to go combine the two. She's going to keep this arm straight up. This arm's going to be straight out. And then when she combines the two, she's going to get a little side bending and then get that coupling motion. Now, a lot of times I tell people to use their eyes, and you can look up in the corner, and your eyes can be a wonderful driver with this exercise. So use your head, use your eyes, and then...
So how many would you recommend?
I would do probably about 10 to 20 reps of each. If you're just starting this exercise, I would just do 10, and then as you feel your thoracic spine loosening up more, then I would do, up to 15 to 20 reps, okay? And then you would do that on both sides.
So I want to make sure we have hamstrings that are really flexible and really strong. So I'm going to show you real quick how to loosen those hamstrings up. And we're going to use Lisa, our graduate student from Central, as our model. Yep, that would be very helpful if we had this here. So Lisa, what I want you to do is stand in front of this chair and put your right foot up on that chair. Now, for somebody that might have balance challenges, you might want to hold on to something, but I think you're going to be doing pretty good. So we're going to do 3 things with the foot up on that chair. I want you to take your upper body and just drive that upper body kind of down and back. And as you go down, you're going to feel some tension behind that thigh a little bit. And I just want you to try this 10 times, going down and back. Okay. Of course, we're going to do this on both sides, but for the sake of time today, we're going to be just on this right side. Okay. Now I want you to go down and hold that position a little bit. And now I want you to take your arms out like this, and you're just going to go side to side for me. Kind of just move side to side. Yep. What that's going to do, that's going to challenge your balance a little bit. It's also going to get that hamstring to kind of stretch in the side to side plane of motion, which oftentimes can be very limited. Okay, and then the third and final motion here for the hamstrings is going to be a rotation right, rotation left with the hands. Okay? And again, we're going to try 10 repetitions of each. I would recommend trying this a couple times a day and seeing if it relieves your neck pain or headaches. Nice job, Lisa.
So further on the flexibility, Andrew hit on the posterior, the backside muscles quite a bit, but your hip flexors are also going to be involved. Your hips in general are going to be involved. I mean, you think about a lot of what we do is sitting, and we get like this, and we look at a computer screen, or look at a TV, and we get like this, and you can imagine the pressure that causes on the back of the neck. Good way to start is to loosen up lower, away from the neck. So what I'm going to have you do is go ahead and throw your foot just right up there on that chair. And again, it'd be nice to have something to hold on to next to you. But for this one, we don't really need to, and we just want to make sure that back foot's nice and straight, and you're doing great with that. And what we're going to do is we're going to just slide our hips forward a little bit, and then we're just going to do these little small pulses there. So I'm doing it over here on the floor. which is fine. There's a little stretch there, but I'm sure Lisa's feeling a little bit more of a stretch in that right hip. So you do about 5 to 10 there, maybe up it as we get further into the exercise. And then we're going to pause when we go forward, maybe about halfway, and then we're just going to slide our hips to the left and to the right. And so now we're getting what we call the frontal plane, or side-to-side motion. And then what I want you to do is take your hips and, just like you're doing in the hula hoop, go in circles there. So we're stretching those hips out in 3 planes, and then of course we repeat this on the other side. What that allows us to do is get into those hips, helps us to stand up taller so we're not bending over to keep our eyes up and putting more pressure on our neck throughout the day.
Perfect.
So to end here, I'm going to get really crazy and talk about how the ankle can even translate on up and affect the neck. And so everything we've touched on so far basically is just improving our body's ability to fight gravity and helping out the neck muscles, making it easier on them when we're walking around or running or doing anything really. And so this last one kind of brings all those together and gives some stability through the foot and ankle. And so what we're going to do, and I'm going to have Lisa do this, is she's going to take a step forward like this. We're going to keep that front leg nice and straight. And all we're going to do is just kind of drive forward, come to that point, kind of put the brakes on, and then come on back. So you kind of go forward and up, just like that. Try to keep that heel on the ground of that front leg. And what this is doing is, as you go forward, you'll feel that foot kind of press into the ground and kicks that calf in behind that ankle. And that's what our calves do when we walk. Every time we take a step, that foot hits the ground, the calves work. Just like what Andrew was talking about with the hamstrings, the calves are just another down the chain that slow us down, help out those muscles behind to keep everything upright, and then prepare us for that next step. And so you could do that. You could even add a reach, just to kind of make it more walking specific. You can reach with both hands, just kind of going forward and up. And you do this with both legs 10 or 15 times. And to start, it might be wise to do it if you had a wall in front, just so you had somewhere to aim towards. Yeah, so those are the nose drivers. Just a good example of how the calf can help out the muscles of the neck there.
And it's crazy to think about, and you're right, it is crazy to think about something that's the furthest away from the neck is actually going to help the neck.
So I think you're right, Keith. We see a lot of patients that come in here with neck pain and headaches that have been to chiropractic, massage therapy, even traditional physical therapy where the focus was on the neck. They move the neck, they traction the neck, they stretch the neck, they exercise the neck, and ultimately the problem isn't the neck. Your neck doesn't wake up in the morning and go, gosh, I'm going to have pain today. The neck is an extension of the body, and the body is usually the source of the pain, not the site of pain. So for more information, visit our website, thesuperiortherapy.com, and thanks for your viewing.